Hello, First Baptist Church family. We're coming to you on behalf of the Health Ministry and Pastor Lowry. As you all know, the COVID-19 pandemic has been truly devastating and has hurt so many in our community. We first want to say that we pray and hope that all of you are being safe and are doing well. We also hope that everyone is adhering to the shelter-in-place or stay-at-home order issued out by our governor. We just wanted to take a minute and give you some helpful reminders and tips as we continue to deal with this pandemic. First off, we just want to go over some of the symptoms that you should look for. Patients with COVID-19 have experienced mild to severe respiratory illness. Some of the symptoms can include fever, cough, and shortness of breath. The symptoms may appear 2 to 14 days after exposure. Please seek medical advice if you develop symptoms and if you have been in close contact with a person known to have COVID-19, or if you live in or have recently been in an area with ongoing spread of COVID-19. Secondly, we would like to express to you that germs are all around you. We encourage you to stay healthy by washing your hands often with soap and water for at least 20 seconds. If soap and water is not readily available to you, please use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash your hands with soap and water if hands are visibly dirty. When washing your hands, please follow these steps to prevent the spread of germs. Wash your hands with soap and water for at least 20 seconds. You want to wet your hands, get the soap, scrub your hands vigorously, rinse your hands, and then dry.
A few facts that we'd like to share with you about COVID-19. 1. Diseases can make anyone sick regardless of their race or ethnicity. Some people are at increased risk of getting COVID-19. People who have been in close contact with a person known to have COVID-19, or people who live in or have recently been in an area with ongoing spread are at an increased risk of exposure. Someone who has completed quarantine or has been released from isolation does not pose a risk of infection to other people. You can help stop COVID-19 by knowing the signs and symptoms: fever, cough, shortness of breath. You need to seek medical advice if you develop these symptoms. There are simple things you can do to help keep yourself and others healthy. Wash your hands often with soap and water for at least 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Now here are a few things to keep in mind. Stay home. Symptoms 2 to 14 days after exposure: fever, cough, shortness of breath. Practice social distancing. Stay 6 feet apart and do not gather in groups. Wash your hands with soap and water. Use hand sanitizer that contains 60% alcohol. Cover your mouth and nose with a cloth face cover when around others.
Clean and disinfect your home. Wash your clothes and your bed linens in hot water. Protect yourself and your loved ones. Reach out to a member of the church if you need help or need to talk. And if you are experiencing symptoms, please call your doctor. And if you should need further assistance during the COVID-19 pandemic, you can text COVID-IDNC to 898-211, or you can simply dial 211 from your cell phone or landline phone. For up-to-date information, we encourage you to please visit the CDC's Coronavirus Disease 2019 webpage. And as always, First Baptist, we love you. We're praying for everyone. We ask that you all please stay safe and healthy, and we look forward to seeing you all back in church soon. Take care. Have a good day.